All right, we are now recording, and I'll get back into sharing my screen. All right, let's get on into the chain of survival. All right, so cardiac arrest, as we know, can happen anywhere, on the streets, in the home, in the hospital emergency department, in ICU, in a room, inpatient. It can happen anywhere. They can happen absolutely anywhere. So the system of care is different depending on whether the patient has an arrest inside or outside of the hospital. Okay? So the two distinct adult chains of survival are in hospital cardiac arrest and out of hospital cardiac arrest. So for patients who are in the hospital, cardiac arrest usually happens as a result of serious respiratory or circulatory conditions that get worse. Many of these arrests can be predicted and prevented by careful observation, prevention, and early treatment of pre-arrest conditions. Once a primary provider recognizes cardiac arrest, immediate activation of the resuscitation team, high-quality CPR, and rapid defibrillation are essential. So patients depend on the smooth interaction of this team that the hospitals put in place. And each hospital has a team. It's a multiple people from all different walks of life in the hospital. You've got your doctors, your nurses, respiratory therapists. There's probably a medical assistant, but they will have a code blue team at a facility. So if you want to be part of that, you can. It's a little difficult when you're in the OR, but if you're free and you hear arrest, you are free to join that team and get involved in that. So that's the in-hospital. Okay, so the links of the in-hospital cardiac arrest are, there's 5 chains. The first chain consists of the surveillance, prevention, and treatment of pre-arrest conditions. The second chain is immediate recognition and the activation of the emergency response system. Third link on the chain is early CPR, with an emphasis again on the chest compressions. Fourth link on the chain is rapid defibrillation. And the fifth link on the chain is multidisciplinary post-cardiac arrest care. Now remember, this is all the in-hospital, okay? So for out-of-hospital arrests, most of those happen unexpectedly at home, okay? Let's see, successful outcome again depends on an early bystander CPR, if there's somebody around that can start compressions immediately, and rapid defibrillation in the first few minutes within the arrest, okay? We guys, we are those bystanders, okay? And they consider us lay rescuers when you read your book. So us lay rescuers, we are expected to recognize the victim's distress, call for help, start CPR, and initiate public access defibrillation until EMS arrives. Now when it says public access, that means if you are in a hotel or you're in a restaurant and you see somebody having a heart attack, then you want to find their nearest AED machine. Almost every place will have one somewhere, okay? Hotels, restaurants, nightclubs. There is going to be an AED most of the time at all of those facilities. So that's what they mean by public access defibrillation, okay? All right, so again, this is the out of the hospital cardiac arrest chain. First link in this chain is early recognition and early activation of the emergency system. The second link would be early CPR. The third link would be rapid defibrillation and AED. The fourth link would be effective advanced life support. And the fifth link would be post-cardiac arrest care. That's when they arrive at the hospital, okay? So those are the two links, the 2 chains. Excuse me. And I wanted to give a little bit of a description in those chains before I played this next video. So let's see here. All right, I think we are ready for scenario instruction. All right, guys, here we go.
Those are just a few stories of providers who know the importance of what you're about to learn. Basic life support, or BLS.
On any given day and at any time, you could encounter a victim of cardiac arrest, because about every 90 seconds, a person dies of sudden cardiac arrest. And with the training you receive today, your actions can give the victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for demonstration purposes in this course, we will perform CPR on adult male victims. Can a marriage check in today?
No, that's not going to work.
John, what's wrong? Are you okay? John? John! Help! Someone please help!
Got a person down at Transoceanic counter 24.
Wake up, John, wake up.
Sir, are you okay? Can you hear me?
He was just on his phone and then he fell over. I don't know what happened.
Possible cardiac arrest, medical assistance needed.
What?
1, 2, 3, 4, 5, 6, 7, 8.
I'll get the AED.
10, 11, 12, 13, 14, 15, 16.
Ma'am, I'm gonna need you to be okay. Excuse me?
1, 2, 3, 4, 5, 6, 7, 8.
Here's your pocket mask.
Apply pads to the victim's bare chest.
I'll attach the AED around your compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Plug in pads.
14, 15, 16, 17, 18.
Analyzing rhythm. Do not touch victim.
Stop compressions. Clear the victim.
Shock advised. Charging. Do not touch victim.
Keep clear.
Press the shock button now. Shock delivered.
Are you okay to
Resume
continue?
chest compression.
Let me know when you need me to take over compressions.
6, 7, 8, 9, 3.
Excuse me. I'll take over compressions. Check your pulse. He's got no pulse. He's not breathing. Start CPR. How long was he down?
About 2 minutes. I started CPR right away. She attached
Attach
AED
the pads to our
around.
defibrillator.
13, 14,
Did you deliver a shock?
7,
We did deliver one and then more compressions and 2 breaths.
2.
Analyzing rhythm. Do not touch victim.
All right, back up.
Clear the victim for analysis.
No shock advised. Resume chest compression.
Wait, he just moved. We've got an organized rhythm.
I have a pulse. He's breathing.
Let's move him.
Let's get the stretcher. You come with us. We're going to go to the hospital.
Okay, thank you.
First, let's talk about the adult chain of survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compressions. After that, rapid defibrillation is used. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest care.
There are slight differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest with patient monitoring and assessment by the medical emergency team or rapid response team when a patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action with the victims seamlessly treated. So now, let's go back and review the links in the chain of survival as they happen.
It's a normal day at the airport. We see the man's wife notice that he's not looking well. After he collapses, she immediately calls for help. A security guard rushes over to help. The guard gets no response or sign of breathing, so he directs a coworker to activate the emergency response system. The chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system.
A rescuer must recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are two simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The guard immediately begins chest compressions without delay.
The second guard returns with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight, portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely. As the EMS providers arrive and take over care, they extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim. Once the return of spontaneous circulation, or ROSC, is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and on interventions that can improve long-term survival. These 5 links of the chain, immediate recognition of cardiac arrest and activation of the emergency response system, early CPR, rapid defibrillation, effective advanced life support, and integrated post-cardiac arrest care, show the most important actions needed to treat cardiac arrest. Basic life support is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for victims of all ages and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen.
You can see the guard scan the scene to assess safety in the terminal, even alerting another officer on his radio. First, he tries to get the victim to respond. Then, he checks the man for breathing by watching for chest rise and fall. He sees no sign of breathing.
Although the guard detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR.
As a lay rescuer, the guard does not check a pulse. Lay rescuers should not check a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally.
Okay, I'm going to say something there, guys. I don't consider, even though we were saying that we are lay rescuers because we're not doctors, nurses, but you know what? We are medical staff. So I still think we should check for a pulse because we know how to check for a pulse. So I just wanted to say that real quickly.
We see the guard start CPR by removing the victim's shirt and giving chest compressions. You can see that he places the heel of one hand on the center of the chest, just over the lower half of the breastbone. Then he places the heel of his other hand on top of the first, and he keeps his shoulders right over his hands for leverage, with his elbows straight.
The critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions in compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of feedback devices to ensure that your compressions are the correct depth. We'll talk about feedback devices later.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compressions. After the second guard returns with the AED and kit, she first turns on the AED. She then removes the adhesive backing and attaches the pads according to the diagram.
And the compressions are given throughout the process to keep blood flowing to the victim's heart and brain. Once the AED is powered on, it will give audible prompts on what actions to take.
Right here, the AED prompts responders to stop compressions while it analyzes the victim's heart rhythm. It takes just a moment for the AED to advise that a shock is needed. The second guard makes sure nobody is touching the victim so that the electrical current from the AED doesn't transfer to someone else. And then she delivers the shock.
Once the shock is delivered, most AEDs will give a prompt to resume compressions. But if it doesn't, compressions should resume immediately.
The guard initially provided compressions without ventilations because he did not have immediate access to a barrier device such as a pocket mask. Once the AED that included a pocket mask arrived, the guard was able to provide compressions and ventilations while the second rescuer used the AED.
The EMS team has arrived to take over. They use good team dynamics by asking the guard to summarize the history of events and care provided.
The EMS team assesses the victim and confirms that he is still in cardiac arrest, so they resume CPR. Now, ventilations are provided using a bag mask device.
The EMS team attaches their manual defibrillator to the victim. The device used by this team can be set to manual or AED mode. Use of the defibrillator in the manual mode requires advanced training to operate that we won't be covering in this course. In this scenario, the defibrillator is set to AED mode.
The AED advises that no shock is required, and the victim begins to move and breathe. The EMS team identifies an organized rhythm and a pulse.
It's worth mentioning that there are many ways that this scenario could have been different. This scenario shows how an integrated system of care helped to achieve a positive outcome, from the bystander recognizing a problem and getting help, to the lay responder initiating care, to the EMS team arriving, stabilizing, and transporting the victim to the hospital for post-cardiac arrest care.
You never know what situation you'll face or what resources will be accessible. But our goal is that with today's training, you'll have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
To begin training, we'll focus on individual skills that rescuers perform. It's most effective to perform CPR as a team. However, to be an effective team member, you'll need to possess the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then tap and shout to determine responsiveness. If there is no response, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the victim's chest, looking for chest rise. Check a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you, the rescuer. Locate the victim's trachea by using 2 or 3 fingers and then slide your fingers into the groove just to one side of the trachea where you can feel the carotid pulse. You can scan for breathing and check a pulse simultaneously to minimize time before first compression. The check for breathing and pulse should take at least 5 but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not definitely feel a pulse, ensure that help is on the way and start chest compressions immediately. In this practice session, you will first check for scene safety. When the scene is safe, approach the victim and tap and shout to determine responsiveness. If the victim does not respond, yell for nearby help and check for breathing and a pulse. If there is no breathing or only gasping and no pulse, ensure that help and an AED are on the way and immediately begin CPR, starting with chest compressions.
We'll pause here before we practice checking for scene safety, responsiveness, breathing, and pulse. So position yourself to the side of your mannequin to practice. The instructor can begin when everyone's ready.
I'm sorry, I wish we were doing this part together right now, but we are not, unfortunately. All right, let me make you guys a little bit bigger so I can see while I talk to you for a second. All right, so any questions right now with the chains? 5 links in each chain. You've got the in hospital and the out of hospital. Okay. And there's only a couple of differences. Just so you know, I sent an email to Jake, and he hasn't responded yet. So hopefully he'll see it pretty quickly and can get that book over to you guys before we even get to that break point. Okay. So fingers crossed. That should have already been done. I apologize. All right. So, so the links, we're going to talk just a little bit about that. So the in-hospital, obviously you've got the first link as the surveillance, prevention, and treatment, because they're already in the hospital. So you typically know if they need to be watched for something like that. So you've got that extra link, the prevention link. So that's a little different from the out of hospital link, where the first link for the out of hospital is immediate recognition and activation of the early response. Okay. So that's the main differences in those two links. And then to make it all confusing, we're going to throw in a pediatric chain. So really the only pediatric differences that I see, or that are the first chain is prevention. Because typically in children, if a cardiac arrest, it's often secondary, like we said earlier, to respiratory failure or to some sort of shock. So identifying children with these problems is essential to reduce the likelihood of pediatric cardiac arrest and to maximize the survival and recovery. So therefore, a prevention link is added to the pediatric chain of survival. All right, so you'll see that that's going to be a little different on the children. All right, so what I want to talk about next before we go any further is the difference between sudden cardiac arrest and heart attack. Does anybody already know the difference between cardiac arrest and a heart attack? Who can tell me, who can give me a brief on the differences?
Isn't cardiac arrest when the heart stops and the heart attack is just a blockage?
So sudden cardiac arrest, it occurs, yes, when the heart develops an abnormal rhythm and can't pump the blood. So it stops from that. And then the heart attack occurs when blood flow to part of the heart muscle is blocked. So yeah, pretty much. All right, so that is something important I wanted to cover. So sudden cardiac arrest, again, it's the heart attack, or it occurs when the heart rhythm develops an abnormal rhythm, and it can't pump blood, or it stops. Sudden cardiac arrest results, we already read that. Sorry, ladies and gents. Okay, and then the heart attack occurs when the blood clot forms in a vessel carrying oxygenated blood to the heart muscle. If the blocked vessel is not reopened quickly, the muscle normally nourished by that vessel begins to die. And then a heart attack is a clot problem, basically. So remember that. Heart attack is a clot problem, and cardiac arrest is a rhythm problem. That should help you with that. All right, so at this point, I actually have a few questions for you guys. I know you don't have the access to the book. Again, I'm sorry about that. Which is the most common cause of cardiac arrest in children? Would it be a cardiac problem, congenital or acquired heart defect, respiratory failure or shock, or infection and sepsis? Which one? Not 4, not D.
Is it respiratory failure?
Yep, C, respiratory failure. You got it. All right, so which statement best describes sudden cardiac arrest? This should be easy, right? I'll read all 4 of them. A, when respiratory distress in adults occurs and the heart rate does not change. B, when the heart rate is 40 to 60 beats per minute and respirations increase. C, when blood flow to the heart is blocked and the heart rate increases. Or D, when the abnormal rhythm develops and the heart stops beating unexpectedly.
D.
D. These are some of the questions that are in the back of each chapter of each one of those sections in the BLS book. All right. All right. So that takes us into section 2. You can't turn your pages to page 13. So now we go straight into talking about BLS for adults. All right, so, excuse me, we're gonna do single rescuer as well as multi-rescuer. BLS for victims who are adolescents or adults, okay? That's what we're talking about. So after the onset of puberty and up. And again, I think we all know the signs of puberty include the chest or underarm hair in males and breast development in females. So if you come up to a little girl who seems to be tiny, but she's developed the breasts, you'll treat her as an adult, but there will be some differences that we'll talk about, whether it be one-handed or two-handed, okay? But we'll, again, get into that in more detail. All right, so everyone can be a life-saving rescuer for cardiac arrest victims. CPR skills that you will depend on your level of training, your level of experience, confidence, basically your rescuer proficiency. The type of victim, child versus an adult, so you'll be comfortable with that. And I'm going to explain, actually I'll explain that a little bit after I talk a little bit about this. Okay, so high performance rescue teams. So coordinated efforts by several rescuers during CPR may increase chances for successful resuscitation. That will come in with part of team dynamics, which we will talk a little bit more in a little bit later. So again, we talked about the CPR consisting of the three: the compressions, the airway, and the breathing. And I wish you had your books. Write down, when you guys get your books, I want you to take a look at figure 4, which is going to be on page 15. And that basically walks you through the steps. It's an adult cardiac arrest algorithm. And these are throughout the book. So it's something that I want you guys to familiarize yourself once we get you that access to that. All right, so let's go ahead and play. I have to skip some of the videos because we're not doing the practice. So we're going to start our first instruction video of adult compressions, and then fortunately for you guys, I'm set up behind me to demonstrate for you. All right, here we go. Let's start with this one.
Now let's practice chest compressions. Before we start, you need to make sure the victim is on a firm, flat surface, lying face up. If you need to remove any clothing from the front of the victim's chest, do it quickly.
A bit later in this course, we'll talk about what to do if someone is unresponsive, not breathing, but does have a pulse. But right now, we're assuming you don't feel a pulse, so compressions are needed.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of sudden cardiac arrest, victims will have oxygen remaining in their bloodstream. So starting CPR with chest compressions can pump that oxygenated blood to the victim's brain and heart. After you give compressions, open the victim's airway and deliver breaths. It's important to minimize interruptions in chest compressions to less than 10 seconds. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. Once you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC. You'll need to work with a bare chest, and later you'll attach the AED pads to bare skin.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast.
You can follow along with what's on the screen as you perform the compressions yourself. You'll perform 3 sets of 30 compressions.
And remember, we'll be performing compressions at a rate between 100 and 120 per minute while counting them out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil between each compression. We'll pause here to give everyone time to get into position.
All right. Okay, so let me make my screen big so I can see you guys. I don't want to stop sharing my screen though. Okay. So, first things first. If you come upon somebody that's laying on the ground and you don't know what's going on, what is the first thing you want to do before you do anything else?
Have someone call 911.
Or, well, assess the scene. So you want to assess the scene to make sure that you are safe and that your victim is safe, okay? And then if the only time you move your victim is, or your patient, whatever you guys want to call them, is if they or you are in danger. If they're in danger, there's fire around, or you see there's a pole that's going to fall on them. If you don't move them, then you move them. Otherwise, or if they're on a soft area, because you want to have them on a flat, firm surface. So if they're not on a flat, firm surface, you're going to move them. All right. So first step is going to be assess the scene, make sure that everybody's safe. Then you're going to check for the responsiveness, and I'm going to demonstrate this. Let me move my stuff. I have to move things a little. Can you guys see that okay? Can you see this okay?
Yes.
Okay. Okay, so you're going to assess the scene. You're going to make sure that everything's safe. And then you're going to come and you're going to check for responsiveness. Hey, are you okay? While you're doing that, you're kind of looking over the body. At this point, I'm going to feel for a pulse, and I'm going to be watching to see if they're breathing. But no more than 10 seconds, right? 5 to 10 seconds, no more. Okay, well, this guy doesn't have a pulse, and he's not breathing. So I'm going to shout to you, or to you, you go call 911. If I'm alone, I'm going to pull out my cell phone. I'm going to dial 911. I'm going to put it in speakerphone, and I'm going to set it down. Okay? Then we're going to get into the compression. So I like to lock my fingers. You guys see this? Can you see it okay? Okay. So I like to lock my fingers. That keeps my grip. You want to keep your elbows straight. Don't ever bend your elbows because you won't get a full, you won't be able to go the proper depth if your elbows are not straight and locked, okay? So we're going to find, but you can't say between the nipples anymore because that's different for everybody. So you want to find the xiphoid process, that little bony part right here, the little cartilage filling, and you want to put your fingers 2 to 3 fingers above that. And that's where you're going to start your CPR, okay, or your compressions. So you've got the xiphoid process right here. Can you guys see this? Too bright, or is it good? So about 3 fingers above that. So where my first finger's at, that's where I'm going to lay my hand, okay? And again, I'm going to lock my fingers. Make sure you guys can see me. Can you see it? Okay. Locking my fingers, and I'm going fast, hard, and you see I'm letting the chest come all the way back up. You're letting that chest have a full recoil, okay? Otherwise, you're not really doing any good. So you're going to count to 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now you see how deep I was going? You know, a lot of times people say, well, I don't want to break the ribs. What if I break the ribs? So what? In reality, you're not really breaking the ribs. If you hear something crack when you're doing those compressions, chances are the cartilage has separated from your sternum, you know, because that's cartilage. It's not bone to bone there. Your rib comes around and then you've got the cartilage that goes to your sternum, right? So if you hear something crunch, it's not really a bone, it's really just the cartilage. But my thought is I would rather you separate the cartilage from my bone than for me to die. So, and American Heart doesn't really get into this, but I do. I like to include it in my class. The Good Samaritan Law. Okay, so January of 2018, Arizona passed the Good Samaritan Law. So there are some stipulations. You are protected if you help someone. You are protected if you stay with them. So once you lay your hands on them, you can't leave them until EMS shows up. Okay, if you start CPR and you're like, this is a useless cause, EMS isn't here yet, I've got to go, then you can be sued because you have touched them and you have left them. All right, this is not, this for whatever reason, American Heart doesn't really cover that, but I cover that with EMS, who I also teach for. And that's something that I like to let everybody know. So as of January 2018, that law has been passed by Arizona, but you cannot leave the patient. Once you've put your hands on them, you have to stay with them until somebody else shows up. Okay? So, all right, so let's see here. I'm going to have, let's see, we're not going to get into the breaths quite yet. Let me look. So agonal breaths. I want to talk about agonal breaths real quick. If you walk up to somebody and you hear them gasping or gurgling or a snorting sound, so to speak, something like that, that's not breathing. So don't let that confuse you and think, oh, well, he's breathing. He's not breathing often, but he's breathing. No, that's not a breath. So if you hear somebody doing that, that's called agonal gasps. Okay? So that is not breathing. And that is one of the test questions. So agonal breaths are not breathing. And they look like they're kind of drawing in air, trying to draw it in real quickly, and it just like shuts off. So they're not getting the air. Okay, so assess the scene, checks for responsiveness. If the victim is not responsive, shout out for nearby help. Activate the emergency response system. That's calling 911 or having somebody do so. If you are alone, you go get the AED if you have one available. If someone else is available with you, you send them to get the AED and you start chest compressions right away. And you continue chest compressions until they show up with that AED. And as soon as that AED shows up, you put those pads straight onto that patient's chest and get them going. So the pulse. For an adult, you check the carotid. You guys all know how to check the carotid. You want to check it on the patient's side closest to you. So if you're on their right side, you want to check their right side. And you want to, you know, obviously don't use your thumb. You don't want to pick up your own pulse. So you check for a carotid and you look for breaths, 5 to 10 seconds, no more than 10. So you can do that all at one time. And then once you discover, okay, this patient is not breathing, there is no pulse, we're going to start CPR. All right. So let me see. Now I think we're going to get into the breathing part. Yep. Okay. Let me make this small again. All right. So we're going to watch a little video about pocket masks first. Let's see. I'm actually going to play 3 videos back to back because they kind of all run in together with one lesson. So I'm just going to play all 3 and get them all out of the way. We're going to start with the pocket mask. Here we go.
So now, let's go through some instruction on the pocket mask, and then we'll practice one rescuer skills with compressions and breaths.
When you're working, you'll likely have access to a back mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with the use of a pocket mask.
Here we saw an example of that. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with the pocket mask is invaluable.
We'll be using the pocket mask for one rescue activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the victim's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique more closely. Place the mask on the victim's face, using the bridge of the nose as a guide for correct position. Seal the mask against the face by placing the index finger and the thumb of your hand closest to the top of the victim's head, along the edge of the mask. Now place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the victim's lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using the head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the victim's tongue away from the back of the throat, relieving a possible airway obstruction.
Then press the mask down while lifting the jaw to hold the mask tightly against the face and give 2 breaths while watching for chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each with just enough force to produce visible chest rise. Rescuers should avoid excessive ventilation. Pause about 1 second between each breath.
In this practice session, you want to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest rise as you deliver each breath over 1 second.
We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths.
All right. Make you guys big again here. All right, so what I have with me is a handy dandy CPR mask. This lives in my first aid kit. Okay, I have a first aid kit like nobody's business. Check it out. This is my first aid kit. I'll show you the inside later. All right, so pocket mask. I love these little things. This is a one-way valve. So it goes just right into the top of the pocket, or into the mask, sorry. And then you can blow the bag up, the balloon up. There's a little valve here that you can unscrew the cap off of. And you could use a syringe to fill it with air. And then you put this right back on. This is my demonstration one, just so you guys know. I have one in my first aid kit that I never take out. It's wrapped, but it's there if I need it. This isn't my demonstration one. So anyway, pocket mask with a one-way valve. Comes in all sizes. This is an infant one. You can see the difference in size. So this is my little baby one that I pray I never have to use, right? That would be a really sad situation. But I have it if we need it. So, okay. So let's demonstrate. Actually, I was going to play another video before we did that. So let me find it here real quick. Bag mask device. So that was the pocket mask. Now let me show you the bag mask device. Bag mask instruction. Here we go. Make you guys small, play, and large.
Later today, we'll practice the skills of 2 rescuer CPR. For the 2 rescuer practice, we'll use the bag mask device. So let's first learn how to use it. The bag mask device consists of a ventilation bag and a face mask, and it comes in a variety of sizes. You can also use supplementary oxygen with the bag mask device.
To begin, position yourself directly above the victim's head. You'll use the EC clamp technique to hold the mask in place.
To do this, place the mask on the victim's face, using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press the edges of the mask to the face. The remaining 3 fingers of your hand should form an E to tilt the head back, lift the jaw, and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest does not rise with each breath, then you're not providing adequate breaths.
But if this occurs, readjust the mask, reposition the head and neck, and attempt to ventilate. And then, only if necessary, administer a larger amount of air.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, each breath given over 1 second after every set of 30 compressions.
Make sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation or air going into the victim's stomach instead of his or her lungs. Gastric inflation can cause vomiting and possible aspiration. To illustrate these points, let's see that portion of the scenario again. You can see that 2 breaths are delivered. She's watching the chest rise as she delivers the breaths to confirm that they're effective, and they're delivered over 1 second with just enough volume to make the chest rise.
If you have multiple rescuers, the most effective way to deliver breaths with the bag mask device is to use the two-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause chest rise. The first rescuer will use both hands to seal the mask to the patient's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face. And the 3 remaining fingers of each hand will form an E, lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the patient's jaw down and block the airway. Now, it's time to practice the one rescuer bag mask technique so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence.
We'll pause here to get into position.
Okay. We will pause here for me to get into position. All right, let me pull this computer back out a little. God, I hope you can see this. Take my mask. All right, can you guys see okay? No, you can't. Aubrey, can you tilt my screen down a little bit, sweetie? I have my assistant with me today. She's gonna help me with the 2 rescuer in a little bit, so. All right, so the bag mask, again, I'm just gonna put it around his neck. So if you're using the bag mask, can you guys all see? I don't think you can really. A little better? Oh yeah, it's a lot closer. Okay, so the bag mask, again, it's gonna go on the bridge of the nose. Nice firm around the face. And if you're a single rescuer, you're gonna obviously stay to the side because this is where you're doing your compressions, but you'll use this hand to tilt the forehead. Notice that my pinky and my ring finger are under the chin. This hand is forming a C around the mask. See how my fingers are placed? So I have control pushing it down. I have my pinkies to lift and my hand on the forehead to help, just to help with stabilization. Okay, and then you go, and then you're gonna give 2 breaths. You didn't see that. My thing was still off. See the chest barely move? You see that rise? Okay. The reason we haven't covered mouth to mouth yet is that actually is a little bit later in the lesson, so I'm not going to get into that right now. We just wanted to cover the bag mask. Now, I don't have a bag, but it's the same type of mask. You guys, we have them in lab hanging on the anesthesia machines if you want to check them out when you get to school. But the mask just goes, the bag goes directly to this and you would just squeeze it from the side, okay? So that would be if you're using a mask, okay? The C, the pinkies, okay? And if you're a 2 rescuer, then you're gonna be at the head of the patient like this. Then you're gonna form the C with both hands and use both hands to tilt the chin, okay? And then either you're blowing or you're bagging. And again, if you've got multi-rescuers, if you're in a hospital, you're gonna have one person do this, you're gonna have one person squeezing the bag, you're gonna have a different person doing compressions. All right? All right, you put down Billy Bob. All right, so let's get straight into the 1 rescuer adult here. With the, I'm pretty sure this shows the bag mask technique as well. Let me make you guys small. And come on. Here we go.
Now let's practice compressions and breaths together using your pocket mask with the one-way valve.
When switching between giving compressions and breaths, limit the time between compression and breath cycles to less than 10 seconds. Make sure the chest rises with each breath, but provide ventilations just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets of 30 compressions with 2 breaths.
We'll pause here to give you a moment to get into position with the mannequins.
That wasn't very long. Okay. All right. All right, so that is single rescuer with a little bit of a pocket mask as well as the bag, the airway bag. Now we are going to get into the two rescuer. All right, so again, like I was saying a little earlier, if you're the rescuer and you encounter an unresponsive adult and other rescuers are available, you follow these steps. So again, you verify the scene. You make sure that it is safe for yourself as well as the victim. You check for your responsiveness. Hey, are you okay? If the victim is not responsive, the first rescuer assesses the victim, and if no mobile phone is available, you send the second rescuer to activate the emergency response system and retrieve the AED if available. All right. So again, if the victim is not breathing normally or is only gasping and has no pulse, immediately start the following: CPR with chest compressions, remove the person's clothing, for two reasons. You do that for two reasons. The first reason is to know for your hand placement. You can get an actual visual of that patient's chest and you know exactly where your hand placement needs to go. And it also opens up the chest for when the AED arrives, because the first thing you want to do is put those pads on that patient, okay? So go ahead and expose the chest right away, get your hand placement, and you're all ready to go when the AED arrives. All right, so once the second rescuer returns, the two rescuer CPR is performed. So you switch off. If you've got more than one person, you want to switch off about every 5 cycles, which takes about 2 minutes to do 5 cycles. And that's 30 compressions and 2 breaths. That's considered one full cycle. So you would do 5 full cycles, which is about 2 minutes. And at that point, you would want to switch if you've got another rescuer. And if you've been doing the compressions, you want to take over the breathing and let that person take over the compressions, because it will tire you out. And if you're tired, you're not going to be as effective. All right. So it is important that if you have other people, to switch off periodically. All right. So you use the AED again as soon as possible, and you follow the prompts. It tells you exactly what to do. And I do have a trainer, so we'll hook that up in a little bit, and we'll kind of do a little bit of that so you can see that. After the shock is delivery, or after shock delivery, or if no shock is advised, you immediately resume the high quality CPR, starting with the chest compressions, and you continue doing the CPR until the AED prompts you to do something else, or until you see the patient move. Obviously, then you've saved their life. All right, so now that we've talked a little bit about what that second rescuer does, I'm going to go ahead and get into the second video. And at that point, we may take a break after that, okay? This is moving a little quicker than I thought it was. This is a good thing. I thought for sure this was going to take the entire 4 hours. So, all right, let me get us going on the two instructor right here, rescuer, a adult. Here we go.
Sometimes a cardiac arrest can occur where treatment is delayed, either because of barriers to accessing the patient or the arrest not being witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater his or her chance of survival and recovery. And early CPR has been shown to double or even triple survival from witness sudden cardiac arrest.
So let's take a look at an instance where CPR was delayed.
Ready for lunch?
I'm not feeling well at all.
What's the matter?
I'm feeling like my stomach is upset. Just really lousy. And they've been coming down with something.
Let me get you some water.
Yeah, I could really use. Oh, I need to head to the bathroom.
You gonna be okay?
Yeah, I think I overdid it with the gardening this morning. I'll be fine after I wash up.
Sam, you all right? Sam, you've been in there for a long time. Sam, are you okay? Oh, call 911.
Medic 2, respond. Medical emergency. 1105 Country Road 59. Unconscious male.
Medic 2 responding.
Medic 2, no other units available for backup. We will dispatch another unit when available.
Goodness, he's inside. The dispatcher asked me to do CPR, but I couldn't do it.
What happened, ma'am?
He wasn't feeling well. He said it was just his stomach. So he was in the bathroom for a while.
What's his name?
Sam.
When did he say he didn't feel well?
Maybe before lunch, and he went in to wash up in the bathroom.
How long has it been since you found him there?
I don't know, 10 minutes, and I was worried about him. I checked on him, and he wouldn't respond to me, so I dialed 911. Company's in here, to the left.
Hey, Sam. Are you okay? No response. He's not breathing. I can't get a pulse. Let's move him to the other room. Let's start CPR. Attach pads to patient's bare chest.
4, 5, 6, 7, 8, 9, 10, 11.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient. For the patient. Clear.
Clear.
No shock advised. Resume compressions.
1, 2, 3, 4.
Let's switch compressors to the next rhythm check.
11, 12.
Analyzing heart rhythm. Do not touch the patient. Clear the patient.
I'm clear.
No shock advised. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3. All right, let's recap. We have an unwitnessed cardiac arrest. We've been at CPR for 10 minutes. We've had no shockable heart rhythm at any time. Is there anything else we haven't done? All right, I'll go ahead and contact medical control to let them know the patient's status and await further instructions. Till then, let's continue high-quality CPR.
So you could see there that the series of events guided the 2 rescuer team providing high-quality CPR. And then their 2 rescuer actions provided crucial minutes of quality care until advanced life support arrives.
Actually, for many healthcare providers and other rescuers, the 2-person or team rescue is a more common occurrence. So let's first look at the roles for 2-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. So they basically treat the situation at first as a 1 rescuer scenario. And the second rescuer is responsible for powering up the AED and attaching the pads.
Now let's review some of the points for 2 rescuer BLS.
Rescuers should pause compressions when giving breaths until an advanced airway is in place. And if you're performing CPR without an AED, rescuers should switch roles when fatigued or after every 5 cycles. That's about 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze. This switch should take less than 5 seconds to minimize interruptions in chest compressions.
The rescuer giving breaths should monitor compression rate and depth, watch for complete chest recoil, and give feedback to the compressing rescuer regarding proper technique.
So now you'll be practicing and working as part of a 2-rescuer team. For most healthcare providers and other rescuers, a 2-person or team rescue is far more common. In 2-rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out.
Rescuer number 1 should be positioned at the victim's side, ready to perform chest compressions and count them out loud.
And rescuer number 2 should be positioned at the victim's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
So let's practice 2 rescuer BLS. Follow the video footage and prompts as you practice. We'll work on the full sequence from the point of finding the patient until advanced medical help arrives. We'll pause here for you to get into position for our 2 rescuer practice.
All right, so, okay, 2 rescuer practice. Ooh, I got a halo. So let's talk a little bit again before my wonderful assistant and I give you a 2 rescuer demonstration. So again, rescuer number 1, you're gonna be by the victim's side. You're gonna make sure the victim is face up on a firm surface, firm flat surface. Perform chest compressions, compression rate of 100 to 120 per minute. Compressing at least 2 inches, because we're on an adult, so at least 2 inches in depth. Allow for full chest recoil. That's letting the chest come all the way back up. After each compression, you want to make sure that happens. You want to, of course, minimize those interruptions. Try not to stop for anything if you can help it. If you have to stop, you want to keep that less than 10 seconds. All right. Use the compression to ventilation ratio of 30:2. And again, I don't know if I've said this yet, but it is across the board the same. It doesn't matter how old you are. It's 30:2 until we get further into infants, and then I'll tell you the little difference, but I don't want to confuse you now. So 30 compressions, 2 breaths across the board. All right. So again, count out loud. You want to count out loud so that person that's doing the breathing for you knows when to expect those breaths. If you're not counting out loud, you're going to have to look at your breather and say, okay, we're ready for the breaths. So if you count out loud, keeps you on track, and it lets the breather know that they're coming up next. So be ready, basically. All right. So Aubrey and I are going to give you guys a little demonstration. Let me pull the laptop out a little bit more again. Let's turn it this way a little up so I'll have more room. Make sure you got, nope, you can see it at all. You guys see that okay? We'll be in front of that light, so that light will be blocked. All right, so Aubrey is going to be my first person that comes up. She's going to assess my scene, and she's going to check on the victim. Go ahead.
Hey, you okay? Oh. Okay, we need an AED.
Shout it, what?
AED. Call 911 when starting compression.
Okay. I called 911.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Awesome.
One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Nice compressions. And as the breather, you're going to be watching and make sure that those compressions are going deep enough and that she's having full recoil. And she's doing fabulous. Good job. Fourth.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26,
I got it.
29, 30.
Okay, so I can tell she's getting tired. Keep going. So I'm going to prepare myself for that when she's done with this cycle, we're going to switch places.
29, 30.
I'm giving 2 breaths, and then I'm going to get straight into position. She would come around and she would take over the breathing, which we're not going to do because she's not breathing in my pocket mask. So, okay. Thank you, Aubrey. You're the bomb, girl. You're the bomb. Okay. Any questions about that? Comments? Violent reactions? No violent reactions? Okay. So that's what a 2 rescuer attempt is going to look like. So, let me ask a couple of questions real quick, and then we'll take us a little break. So, the man doesn't respond when you touch his shoulders and shout, "Are you okay?" What is your next best action? A, check his pulse. B, start high quality CPR. C, start providing rescue breaths. Or D, shout for nearby help. Anybody? Anybody?
Check pulse.
So this one's a little tricky, which is why I'm asking it. So if he doesn't respond as soon as you tap him, hey, are you okay? You shout for nearby help, okay? If you're in a busy area. Obviously, if you're at home, then that's going to change a little. But that is one of the questions in the chapter review, so it's probably going to be one of the test questions, maybe not. But anyway, so just remember, if you tap somebody, hey, are you okay? Your next step is to shout for help, okay? And then start the CPR. All right, question. Several rescuers respond and you ask them to activate the emergency response and retrieve the AED and emergency equipment. As you check for a pulse and breathing, you notice that the man is gasping for air and making a snorting sound. You do not feel a pulse. What is your best next action? A, start high quality CPR, beginning with chest compressions. B, monitor the victim until additional, more experienced help arrives. C, provide rescue breathing by delivering 1 breath every 5 to 6 seconds. Or D, find someone to help by retrieving the nearest AED.
A.
Yes.
A.
Yes. Start high quality CPR. You got it. All right. So that's all the questions I had marked in that because I created a Kahoot, which I think is probably going to be I think we'll do the Kahoot. I'm trying to decide if we have time to do it as a class, as a group, we're going to do it as a group. And then you just take a screenshot of the end of it where it shows your little passing thing. And then we'll have you upload that for today's attendance. Does that sound easy enough? Okay. All right. So why don't we take a 15-minute break and come back? Well, it's 33, come back around 45, 48. And then we'll get into talking about the AED. And then we'll go on into pediatrics. Sound good? All right, go grab you some water. Might make you guys all find a pillow so we can practice some compressions. I'm just kidding. You'll get your practice next week. All right, we'll see you guys in 15. All right, here we go. All right, let me get back into my screen share. Good, that was much easier than last time. All right, so now we're going to talk about the AED, which stands for Automatic External Defibrillator. All right, and for this section, we're going to talk about first for adults and children 8 and older. So an automatic external defibrillator is a lightweight, portable, computerized device that can identify an abnormal heart rhythm that needs a shock. An AED can deliver that shock that can stop the abnormal rhythm, which is otherwise known as ventricular fibrillation or pulseless ventricular tachycardia. So it will stop that abnormal rhythm and it will allow the heart's normal rhythm to return. So that's basically what the AED is for. It's very simple to operate. Literally anybody can use it. It has detailed step-by-step exactly what you do and what not to do. So as soon as you have that available, you want to get those pads on that chest as quickly as possible and get that machine turned on. And when it says that it's analyzing the rhythm, you don't want to touch the patient. You want to step back because it's trying to pick up whatever rhythm is there, if there is a rhythm. And if you're touching the patient, it could pick up your rhythm. So that's why you want to stand back while it's analyzing the patient. So the time between collapse and defibrillation is an important factor in survival from sudden cardiac arrest caused by, again, ventricular fibrillation or pulseless ventricular tachycardia. So to make early defibrillation possible, an AD or defibrillator should be immediately available to the BLS provider responding to the cardiac arrest. Again, we mentioned a little earlier, you can find them everywhere. You can find them in airports, hotels, shopping malls, restaurants, any places where they tend to have a lot of people, you usually will find an AED. I actually sell them. Anybody wants to buy them? I'm just kidding. So I actually sell those for EMS safety. I haven't sold one. I'm not going to pretend like I have. It's not something that I'm, really want to get out there and push. So I haven't sold any yet, but I can. So if anybody that you know is looking to purchase one for a business, let me know because I can hook you up. All right, so maintaining the AED and supplies. So AEDs should be properly maintained according to the manufacturer's instructions, and maintenance could include battery replacement. I had to change mine this morning. Now, when you guys see mine is not real. Mine is a trainer only, so don't get scared. I don't want to scare you. But anyway, so battery replacement is important. Calibration and testing of the energy dose, that's something that you want to have done periodically. I don't really know what the accurate time is. My guess is it's probably every 6 months because that's a life-saving tool. And I know that for laser machines, they have to be checked every 6 months. So chances are it's probably about every 6 months to a year that they have to have those calibrated. AED pad replacement, okay? Make sure that you've always got pads available in your AED machine. A lot of AED machines come with adults and infants and children, so they have each size. Some of them will not come with the children's pad sizes, but they may have, I'm trying to figure out what it's called. Actually, it's in the pediatric portion, so we'll talk about that later. But that will come with a special cable that you can plug in and use the adult pads for an infant. So again, we'll talk about that a little bit later. So again, once the AED arrives, you want to get that started right away. Put it on there and get it going, get it analyzing that patient as soon as you can. And it's very simple. Like I said, I'm going to grab mine. So it'll come in some little bag. It may even be behind glass that you have to break the glass like an emergency thing, or just pull like the little plexiglass thing out like the gas valves and the ORs. It may be something like that. But they're very simple. You literally pull it out of its case, okay? You turn it on.
Remove clothing from the patient's chest.
Okay, it's telling me to remove the clothing.
Open packet and apply pads onto patient's bare skin.
Okay, open packets, and if you'll notice when you pull them out,
as shown in the pictures.
they will show you where they go.
Open packet and apply pads onto patient's bare skin.
Hold on, there we go. So it will show you on the pad
as shown in the pictures.
where they go on the patient.
Open packet and apply pads onto patient's bare skin.
So I haven't done that yet, so it's going to keep telling
apply
me.
Pads as shown in the pictures.
Now I'm going to pretend.
Press pads firmly on skin. Apply pads as shown in the pictures. Apply pads as shown in the pictures. Press pads firmly on skin. Apply pads.
Oh, come on, don't make me do it.
Pictures.
Okay, hold on.
Apply pads as shown in the pictures. Press pads firmly on skin.
It's going to make a liar out of me.
Apply pads.
Okay, it's not picking it up because I don't have it on my mannequin, but when we go through the demonstration, hopefully you'll be able to hear it loud enough. But anyway, so this is what it would look like. So again, and if you look at these pads, you see how it has a child on the bottom? So that's just basically telling you that these are adult pads, but this is how you would use them if you're putting it on a child. So one would go on the front, one would go on the back, okay? But for an adult, one's gonna go up here, and one's gonna go down here on the side like this, okay? All right, so we'll get into that a little bit more. Let me fold this back up for our demonstration with my handy dandy assistant. Kind of nice having an assistant. I taught her CPR and first aid last year because she babysits. So my stepdaughter, who's 15, and she's good. You saw her compressions. Her compressions and her breathing is phenomenal. Okay, so that's what an AED looks like. So again, you open the case, you turn the power on, and you literally follow the prompts. It's just that easy, okay? Some things I want to cover before we watch our video, some special considerations. Okay, if your victim is really, really hairy, that can cause a problem. Your pads are not gonna stick to the skin, they're gonna stick to the hair and then they're gonna lift. So you're not gonna have a good seal. So some of these AED kits come with a razor for that reason. If it has a razor, great. Shave the areas that you're gonna place the pads. Doesn't matter, dry shave, just get it over with. Place the pads down. If your machine does not come with a razor and you have more than one set of pads, you'll take your first set of pads and you'll put them down and you will rip it off like nobody's business. And you will basically wax that patient with one of those pads. Then you would take a fresh pad, fresh set out, and you would put it right where you removed that hair. They're out, they're unconscious. They don't know what's going on. They're not gonna feel that hair. If they feel that hair, well then that's just like a miracle. You have ripped off hair enough to cause them to get that heart back into a regular rhythm, which, hey, you never know, right? That could happen. But anyway, so that is something that you want to consider. If they're hairy, again, a lot of them come with razors. While your first rescuer is doing the CPR, while they're doing the compressions, this would be you as a second rescuer. You're the one that's calling 911. You're the one that's getting the AED. Your first rescuer is doing compressions. You're pulling off those pads. You're waxing. You're doing whatever you have to do to get those pads to stick. Okay? So that's the hairy chest. Remember that. If the victim is lying in water, if they are actually physically laying in a puddle of water, you want to pull them out of that water. Okay? If their chest is wet, if they've just gotten out of the pool, you've pulled them out of the pool, you want to dry that chest off. You do not want any water. Water is dangerous when it comes to an AED. So pull them out of the puddle, get them into a dry area, and dry off their chest if need be, okay? So water and electric don't mix. implanted defibrillators and pacemakers, or oh gosh, what are they called? Somebody help me out. Ports, like the little dialysis ports. You know what I'm talking about? Or portacath? Okay. So if a patient has a bump or a lump, it would most likely be over here. If you see their skin raised up from one of those devices, you still want to place the pad in that area, but at least an inch away from that device. So if that device is right where you need to put that pad, you just move it down about an inch, and you don't want to cover that device. Medication patches. If they have a medication patch up here where you're going to be placing that, either place, don't pull it off with your bare hands, because you don't know what the medication is, and it can absorb in your skin. But most AEDs again come with gloves. So grab those gloves and put them on, because you don't know what you're going to encounter when you get back in there or when you get to the victim. So just go ahead and put those gloves on that come with it, just in case. If they have a medication patch, pull it off with a gloved hand, okay? And then you can place that pad right there. All right, so those are some of the important considerations. So with that, I will go ahead and play. I have to get back up here to lesson 3. So I will go ahead and play the instruction, and then my assistant and I will do a demonstration, okay? Let me make you guys small again. And AED, here we go.
Now we'll see a scenario with rescuers from multiple agencies.
The real challenge in situations like this becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved.
Dispatch, this is Engine 1. We're on the scene.
Copy that, Engine 1. Time is 14:55.
We have one vehicle upright, no signs of damage, no hazards noted. We have 2 victims present, one is still in the vehicle.
Engine 1, one vehicle upright, no hazards noted. 2 victims total.
What's his name? Russ. Hey, Russ, can you hear me? No response?
So what happened?
We were driving and my dad started having chest pains and we rolled into a ditch and he just now passed out. No breathing. No pulse.
This is cardiac, not trauma. He needs CPR right away. Alert the medics that we have a cardiac arrest and get the AED. Got it?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Attach pads to patient bare chest.
5, 6, 7, 8, 9, 10, 11, 12,
In path
13,
connector.
14, 15, 16,
Second, get ready to rotate in for compression.
21, 22, 23, 24, 25,
Analyzing
26,
heart rhythm.
27,
Do
28,
not touch
29,
the patient.
30.
Clear.
Shock needed. Charging.
1, 2, 3, 4, 5,
Stay
6,
clear of
7,
patient.
8.
Deliver shock now.
Clear, everybody, clear.
Shock delivered.
1, 2,
Resume
3,
CPR.
4,
Start
5,
with
6,
compressions.
7, 8, 9, 10, 11, 12. What do we got? 14.
Victim in cardiac arrest when we arrived. No sign of trauma. The doctor says he was having chest pains and went unconscious just before we arrived. We shocked him once and we've been at it for about 3.5 minutes.
Thanks. We'll switch up monitors after the next rhythm check.
Jacob, compress a little more deeply and avoid leaning.
22, 23, 24, 25,
That's better.
26, 27, 28, 29, 30. 1, 2, 3, 4.
Analyzing
5, 6,
heart rhythm.
7,
Do
8,
not touch
9,
the patient.
10.
Clear the patient. Clear.
Shock needed. Charging.
1, 2,
Stay
3,
clear of
4,
patient.
5,
Deliver
6,
shock
7,
now.
8,
Clear
11.
patient.
Clear.
Press the flashing button now.
Shock.
Shock.
Okay, do you guys, I want to interrupt here. Do you guys see how every time they stop, he continues to do the chest compressions until the AED instructs him otherwise, and that's what you would want to do. You would want to continue those chest compressions until it prompts you otherwise.
Delivered.
1, 2, 3, 4,
Resume
5,
CPR.
6,
Start
7,
with compressions.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3.
Good job with chest compressions. Keep it up.
6, 7, 8.
We should start an IV. Let's draw.
Hey, I just saw some ice letters.
Stop compressions. Check the monitor.
We have an organized rhythm.
Let's check the pulse.
We got a pulse. Hey, Russ, can you hear me? Come on, Russ, wake up, Russ. No response.
Is he breathing?
No, I'll continue begging.
Remember to give one breath every 5 to 6 seconds. I'll start an IV. Let's get a blood pressure. How easy is he to bag?
His ventilation's good.
Let's get ready to transport.
Okay, again, I'm going to interrupt. So you heard he has a pulse, but he's still not breathing on his own. So they're going to continue giving him breaths, one every 5 to 6 seconds. That is a question on your test, just so you know.
Let's watch the scene again, paying special attention to the use of the AED and providing breaths by using a backmask device. When the team members arrive, they assess the scene and try to get a response from the victim. The emergency responder takes a few seconds to check for breathing, looking for no breathing or only gasping, and at the same time, attempts to feel for a pulse. Finding no breathing and no pulse, the team alerts the paramedics en route that this is cardiac arrest. The team moves the patient to a hard, flat surface to begin CPR. One rescuer starts compressions, while the second delivers ventilations. A third rescuer sets up the AED and begins attaching the pads to the patient.
During compressions, the compressor counts to 30 so that 2 breaths can be given after each set of 30. The AED is attached and signals that it's ready to analyze. This provides an opportunity for the compressor to switch. We need to point out that it's important to know your AED or defibrillator because there are different models, and it's also important to follow your device's prompts. You may have noticed that the compressor took advantage of the time the device was charging to deliver a few crucial compressions.
High-quality CPR and rapid defibrillation are priorities. The emergency responder operating the AED is responsible for clearing all rescuers to allow for rhythm analysis. If a shock is advised, the emergency responder again clears everyone and delivers the shock.
As soon as a shock is delivered, another set of compressions begins with a different rescuer delivering compressions and using a feedback device. Feedback devices can monitor CPR quality regarding rate, depth, and chest recoil, and provide real-time corrective feedback to rescuers. After each set of 30 compressions, the emergency responder delivers 2 breaths, ensuring that the chest rises with each breath.
The paramedic team has arrived. Now, the team leader directs the handoff without any interruption in CPR by providing a summary of events.
Now let's focus on the use of the AED. You'll need to take a moment to familiarize yourself with the type of AED device used in your training class today. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED. Just open the carrying case or the top of the unit and simply power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's chest by using the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the victim's age, use the adult pads. You may also need to plug in the pads for certain models.
Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple and the other on the victim's upper right chest, directly below the collarbone.
After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the victim's rhythm, followed by a prompt to clear the victim. The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and people receive the command. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. The rescuer should again repeat the command to those nearby. Loudly state something like, "Everybody clear?" or simply, "Clear." And visually make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered. Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of the pads to the bare skin.
Water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart.
If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump, smaller than a deck of cards. If you see this lump, avoid putting the pad directly over it.
Also, do not place the pad directly over a medicine patch. If the medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that model. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on the victim.
All right. Let me get you guys back here with me. Excuse me. All right, AED. Any questions about it so far? No questions, no questions? Okay, okay. All right, so you guys ready for another demonstration? Okay. So what we're gonna do is Aubrey and I are gonna do to rescuer again. And only this time we're gonna involve the AED. So we will run through and show you what it looks like live with a mannequin, okay? Let me get you guys in place again. Let's see here. Good there. Okay, all right, you're up. Aubrey's going for a stroll in the park. If you see somebody down.
Hey, you call 911 and get an AED.
Hey,
Hey, you okay? I feel no pulse.
911. I'm calling 911. Hi, we have someone he's down and we need compression. We've got compression started. We need an ambulance right away. Okay, blah, 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 blah. Thank you, goodbye. Right, we got 911 on.
26.
Another.
Oh, yeah, you're good.
Okay. Don't you love it when something doesn't work? Okay, it's analyzing the rhythm. Do not touch patient. Analyzing the rhythm. Shock advised. Do not touch patient. Clear. It's telling me to shock. Okay. CPR. So she's going straight back to CPR. Hello?
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Nice job.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4.
So for this, so for this particular trainer, it's going to keep doing the same route unless I change it, and I don't have a remote to change it. So basically what we've done now is it's analyzed the rhythm. It's told us to give one shock. You make sure that you are clear. You're not touching that patient. You provide that shock and you go straight back to compressions until it tells you otherwise. Any questions for that? All right. So you want to put the little plastic things back on them, sweetie, and then here. There's another one somewhere down there, close to Grayson. All right. So that's what you would do with an AED. So whoever's doing the breaths, you're going to be that person that hooks up those pads, because the first rescuer is going to continue those compressions. All right. And you will continue those compressions unless that machine tells you otherwise. So one thing I do want to show you, let's see, where's the AED instruction bag mask? I thought that was an actual practice. Okay, that's not an actual practice. I thought we had an actual practice for the AED. It's just with the instruction. All right, so let me ask a couple of questions. So what is the most appropriate first step to take as soon as the AED arrives at the victim's side? A, power up the AED. B, apply the pads. C, press the analyze button. Or D, press the shock button.
Power on.
Yes, ma'am, power on. So that's the first step we do. You turn it on, and then you start pulling out the pads, and then you start placing them. So yep, you power it up first things first. All right, if a victim of cardiac arrest has an implantable pacemaker or defibrillator, what special steps should be taken? A, avoid placing the AED pad directly over the implanted device. B, avoid using the AED to prevent damage to the implanted device. C, turn off the implanted device before applying the AED pads. Sorry, I laughed at that one. Or consider using pediatric pads to decrease the shock dose delivered. Anybody? Nobody? So it would be A, avoid placing the AED pad directly over it, right? We can't remove it. We can't turn it off. We can't use pediatric pads because it's not going to be a strong enough shock. So you just move it down and you just don't place it on top of it, okay? All right, so that is AED. Now we get into talking a little bit about team dynamics. Successful team dynamics are crucial during a multi-rescuer resuscitation attempt, regardless of the location. Poor communication among team members can negatively affect the performance. And this is something that you really want to have. Communication has got to be key during an emergency like this. All right. So whether you are a team member or a team leader, it is important to understand not just what to do in a resuscitation attempt, but how to communicate and perform effectively as part of a team. Chest compression fraction, it talks a little bit about listing the team dynamics. It says shorter duration of interruptions in chest compressions is associated with a greater likelihood of return of spontaneous circulation, shock success, and survival to hospital discharge. So basically they're just saying if you've got more people and less interruptions, so you have somebody doing a particular duty, so to speak, during the emergency, then it should run smoother. If you're doing compressions and I'm doing the breathing and this person is bagging, you know, I'm holding the mask, somebody's bagging, everything's going to go smoother. And then there's always that person that's going to be watching, whether it be a team lead or whether it be the breather. You're going to watch that first rescuer while they're giving compressions. You're making sure that they're not getting tired. You're making sure that they're going deep enough. And if they're not, and you see that, you have to be able to speak up and say, you need to go a little bit deeper, or keep with that rhythm, maybe keep it a little faster. You know, you guys have all heard, I'm sure, that over the last few decades, they've been playing Staying Alive as their song to keep with the rhythm. Staying alive, staying alive, Okay, so if you can keep to that song, you're gonna go the actual rhythm. Now for my childcare class, I play Baby Shark. Aubrey laughs. She's like, yeah. Yeah, she was 15 when we gave that class. So, but anyway, so find a song if that helps you. Find a song that goes with that rhythm, and in your mind, you know, kind of keep that beat in your head if it helps. You know, if you're concerned whether or not you're going at the right rate, pick a song, sing Staying Alive, at least for a few, so you get the rhythm, and then you can get into your counting. But you definitely want to count out loud. That's really, really important. All right, so team dynamics. Obviously, it's important to communicate, correct actions if you see them. You've got the team leader and team members. The team leader is going to call each team member by name and make eye contact when giving an instruction. That way they know that, you know, that team leader is talking to you. Or you as the team leader, you are dressing as a particular person. You look them eye to eye so they know there's no miscommunication. And then respect. Have mutual respect for everybody on the team, because you all are trying to save somebody's life. So you definitely want to have good mutual respect. So the first video I'm going to play is poor team dynamics scenario. And this is basically an example of what not to do. All right, so let's start this one. Make you guys smaller. Here we go.
It's a wonderful thing to see teamwork move so smoothly.
That collaboration is partly due to the staff knowing BLS and their responsibilities, and to them communicating well. It's also due to a team leader giving directions clearly.
No, not yet.
Successful team dynamics are critical during a resuscitation attempt. The interaction among team members has a profound impact on the effectiveness of each individual's performance, as well as the patient's survival. The better you work as a team, the better the potential outcome for your patient. That's why it's so important to understand not just what to do in a resuscitation attempt, but how to communicate and perform as an effective team, regardless of your role as team member or team leader. To appreciate good team dynamics, it helps to understand what happens when team dynamics fail. Let's watch the following example of poor team dynamics and see if you can spot the areas that need improvement.
4, 5, 6, 7, 8, 9, 11, 12.
We've got a teenage boy in full rest here.
8, 9, watch out, watch out. Move him over. All right. Stop. He's still strapped to the cot. All right. Move on 3. Ready? 1, 2, 3.
When we got there, he just said he wasn't feeling very good.
Let's go ahead and hook him up to the monitor. We need to ventilate.
We've already shocked him twice, once about a minute ago.
We need to get an IV started.
Have you shocked him? 6.
Yeah, last time a minute ago.
James, take over compression. Okay, I'm fine. I'm fine. Got it.
James, you need to do continual compressions with the breath every 10 seconds.
No, do 30 and 2. What have you done besides shock?
Just basic life support.
Laura, can you take care of that IV?
Okay.
Who's documenting? Kayla.
I'll get on it.
The scenario you just watched presented some serious communication flaws, the kind of flaws that can derail a resuscitation attempt.
Okay. So that was really, really poor teamwork, right? You could kind of see it as they were going. They looked like they just didn't know what they were doing. It seemed very confusing. Okay, so now we're going to go straight into the team dynamics review video. Maybe.
Successful teams not only have medical expertise and mastery of resuscitation skills, they also practice good communication skills and adhere to the key elements of effective team dynamics. These elements help teams work together in the most efficient way possible. The American Heart Association has grouped the elements of team dynamics into 3 categories: roles, what to communicate, and how to communicate. Let's review those now, starting with roles. Clear roles and responsibilities should be immediately established. When all team members know their jobs and responsibilities during a resuscitation attempt, the team functions smoothly. The designated team leader should clearly define and delegate tasks according to each team member's area of competence. Every member on the team should know his or her limitations, and the team leader should be aware of them. Team members should ask for assistance and advice early, not when the situation deteriorates. Sometimes a team member or team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you have to correct a colleague before he or she makes a mistake, whether it's a drug, dose, or intervention. The next category is what to communicate. Knowledge sharing is a critical component of effective team performance. Team leaders should ask for good ideas for management and frequently ask for observations from team members about possible oversights. Summarizing information out loud is a good way to maintain an ongoing record of treatment and acts as a way to reevaluate the patient's status, the interventions performed, and the team's progress within the algorithm of care. This technique can also help team members respond to the patient's changing condition. The last category of team dynamics is how to communicate. Closed-loop communication is important for both the team leader and team members. When the team leader gives an order, the team member should confirm that he or she heard and understood the order. The team leader should call people by their names and, if possible, make eye contact to ensure that the team member has understood the order before assigning additional tasks. The team member should tell the team leader when he or she has completed the intervention. Team leaders and members should also use clear messages. Using concise, clear language helps prevent misunderstandings. Speaking in a tone of voice that is loud enough to understand, but also calm and confident, helps keep all team members focused on the task at hand. All team members should display mutual respect and a professional attitude to other team members, regardless of their personal expertise or training. Because emotions can run high during a resuscitation attempt, it's especially important that the team leader speaks in a friendly, controlled voice and avoids shouting or aggression. Not only is it important to know what to do during a cardiac arrest, but it's just as important to know how to work together as a team during an event. Debriefing as a team is an important component of every resuscitation attempt. Such debriefing during and after an attempt helps individual team members perform better, and it may also bring system strengths and efficiencies to life. Implementation of debriefing programs may even improve patient survival after cardiac arrest. Now we'll see the same scenario with everyone using good team dynamics. See if you can spot each key element in use.
Hi, everyone. EMS just called in and said they have a 16-year-old male who arrested in their unit as they were arriving. They're unloading now, and Pam is meeting them in the ambulance bay. She'll ventilate when they arrive. James and Aaron, can you two cycle through chest compressions for the first rounds? James, you're first on compressions, and Aaron, I need you to hook them up to our monitors and D-tip.
Yeah, I'll start on compressions.
And I'll have monitor and D-tip.
Okay. Okay, good, thanks. Laura, can you take IV and meds?
Yes, I'll take IV and meds.
Kayla, I need you to record.
I'll record.
Great.
Hi, we're a BLS crew. 16-year-old male here with his cardiac arrest precisely 3 minutes ago. We started compressions, applied our AED, and gave 1 shock with no rust. We gotta give a second shock at the 2-minute mark with no change so we could see he has been easy back.
Okay, thank you. Let's move him over at 30. 28, 29, 30. 1, 2, 3.
And Mike, I'll take over compression.
All right, thank you. Good switch. James and Aaron, you can swap out compressions every 2 minutes or sooner if you get tired. Do we have an IV?
No, I'm working on the IV now.
Laura, if you can't get the next to stick, try an IO.
I'm recording. Hey, monitor is attached.
No compressions. Do not feel a pulse. He's in PEA. Continue CPR.
Hey, IV is in flush.
Good.
James, please provide continuous compressions and I'll give a breath every 8 seconds.
Are you sure? I think it's 32 until an advanced airway is in.
He's right. Good catch, James. Continue 30 compressions with 2 breaths for now. Kayla, can you provide a summary of the action so far?
We've inserted an IV and attached the monitor.
As you've just seen, designating team roles and good communication allows for a rapid and orderly response in an emergency situation. Clear direction and effective communication by all team members creates an environment where patients have the best chance of survival. The ideal situation is a team with multiple rescuers to perform all needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, members may be assigned more than 1 role. Some roles have a higher priority than others. The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes or sooner if tired. The rescuer, positioned by the victim's head, maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation. The team member operating the AED or the monitor or defibrillator typically alternates roles with the initial compressor. Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. That's because it's important for the team leader to monitor CPR quality, including the depth of chest compressions, chest recoil, and chest rise from ventilation. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed. The timer or recorder keeps a record of the events that occur, including frequency and duration of interruptions in chest compressions, time of shock delivery, and medication administration. When additional advanced responders are available, 1 rescuer is responsible for starting an IV and administering medication. This rescuer should be positioned at the victim's side, near the hands and legs, to avoid interfering with compressions and ventilation. When only 2 rescuers are present, they typically take the roles of compressor and airway, with 1 rescuer also covering monitor or defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor or defibrillator.
All right. Okay, so team dynamics, you guys saw both scenarios. You see how it ran much smoother with the communication and everybody knew what their roles were. Every team member knows their limitations and so does the leader. So if the leader knows your limitations, he or she knows whether or not you should be in the compressions role or if you should be breathing, or so always let them know what your limitations are and what you can and can't do. Constructive intervention, again, if you don't think the person that's doing the compressions are going deep enough, let them know that they need to go deeper. Knowledge sharing, they talk about that again. It's important to share what you know during this situation. Okay, that's going to improve a more successful outcome, I guess you should say. Summarizing your information out loud, say out loud what you're doing. If you're counting out loud. If you're giving breaths, you know, you're telling them, hey, I'm ready for the breaths. But just communicate, okay? And then again, they talked about the types of communication, the team leader versus the team members, and then having mutual respect for each other, and then debriefing, kind of summarizing what's been done. That way you keep everybody on the same page as well. All right, so I'm gonna go straight into another video about high performance teams. I figured this will be a good time for this video. So we'll just get straight into this one.
Now, let's apply the information you learned in the team dynamics video.
Your team will be asked to treat a cardiac arrest victim.
Your instructor will read a scenario and choose a team leader.
This scenario will run for 10 minutes with the goal of providing high-quality CPR and enforcing the principles of highly effective teams. This exercise is purely practice and not a test. The exercise will, however, reinforce both skill performance and improving the overall resuscitation provided to the patient.
To evaluate the resuscitation provided, your instructor will be looking for high-quality CPR, which includes compressing at least 2 inches or 5 centimeters on an adult victim at a rate of 100 to 120 compressions per minute, allowing full chest recoil between compressions and avoiding excessive ventilation. Another critical component of high-quality CPR is minimizing pauses in compressions, so your instructor will be measuring chest compression fraction, or CCF. CCF is the proportion of time during a resuscitation attempt when the patient is receiving chest compressions. Fewer interruptions are associated with increased ROS and increased likelihood of survival to hospital discharge.
Targeting a high chest compression fraction is desirable for survival outcomes. A chest compression fraction of at least 60% is recommended, and a goal of 80% is often achievable with good teamwork. At the end of the exercise, your instructor will conduct a debriefing session to determine where improvements could be made in future attempts.
Okay, obviously we can't do that today because we're not together. However, next week when we do our skills, we will do some sort of an emergency kind of little run through for you guys to kind of give you the feel of what that's like if you're walking in on an emergency. And we'll have you do single, and we'll have you do 2 rescuer, and that's as far as we'll go for class, to minimize how close you guys are all together in class. So, and there will be no, we will cover mouth to mouth here in a little bit, but we won't be doing the mouth to mouth. We will only use the airway bag for skills on Monday. Okay. All right, so let me ask the question. So after performing high quality CPR for 5 minutes, the team leader frequently interrupts chest compressions to check for a pulse, even though the victim has no organized rhythm when the AED analyzes the rhythm. Which action demonstrates constructive intervention? A, ask another rescuer what he or she thinks should be done. B, say nothing that contradicts the team leader. C, suggest to resume chest compressions without delay. Or D, wait until the debriefing session afterwards to discuss it. So if you need to give constructive feedback, basically, in the middle of a CPR, in the middle of compressions.
Would it be C?
Mm-hmm. Yep, suggest to resume chest compressions without delay. Yep. All right. Okay, the team leader asks you to perform bag mask ventilation during a resuscitation attempt, but you do not have perfected skills. What would be an appropriate action to acknowledge your limitations? Would you A, pick up the bag mask device and give it to another team member? B, pretend you did not hear the request and hope the team leader chooses someone else? C, tell the team leader that you are not comfortable performing that task? Or D, try to do it as best you can and hope another team member will see you're struggling and take over?
B. I'm just kidding.
I was gonna say not B. Like, did you hear me? Crazy kids. Anybody?
C.
C? Yep. Tell the team leader you're not comfortable with doing it. So you have to speak up. If you're really not comfortable with that portion, Maybe you could record. Maybe you can just keep notes if you really don't feel comfortable, but you got to speak up so they know. All right, let's get straight into BLS for babies. We're getting there, guys. We're not too far off. I did get a message back from Jake. He said he apologizes that you guys did not get the books prior to class. He did request them. They should be emailed to you guys by tomorrow at the latest. It's okay because you don't really need them today, but you will need them through the week to study a little. And then after your skills on Monday, you'll go to the computer lab and take the test for it. So you will need your books. So hopefully you'll have those by tomorrow. Okay? What's that, Myra?
Are we going to be meeting at school as a group or?
Yes, so Monday we'll divide because there's 21 of you guys. Haven't really decided yet how we're going to do it. We're probably going to, because I don't think we're going to need more than an hour with each group. I'm going to do groups of 7. So we'll probably do like from 1 to 2. And then like 2:15 to 3:15, and then 3:30 to 3:30 to 4:30. I think that'll be good. But you guys can only do 3 at a time. So there'll be 7 of you there. We'll have the first 3 do it. We'll have the second 3, or we'll split you up in 2s, 2, 4, 6. Somebody's going to go by themselves. Either way, because I can only watch 3 at a time. So we will get you guys in there for about an hour to an hour and a half in each group. And that'll be all that you'll be required to do that day. We won't need a Zoom or anything like that. So you'll just come in at your scheduled time. We'll do your skills portion. And then you take the CPR final exam, the BLS final exam, which is right out of the book, basically. So, and then that'll be it. So I think that should be, I think that's probably the best way to do it, between an hour to an hour and a half for each group of 7, because it won't take you long. Your cycle is about 2 minutes each cycle, which is 5 cycles basically, is for about 2 minutes. So I think we can get you all through it pretty quick and easy. But we'll be distanced, so you don't have to worry about that. We will be distanced, so you won't be right beside your partner. Okay? All right, so any questions? Any other questions right now? Ready to get straight into to the babies, infants and children? Okay, let me make you guys small again. Oh, my nose itches. All right, so BLS for the babies. All right, so we're gonna play children first. BLS for children first. All right, this one gets my heart.
Pediatric cardiac arrest is not as common as adult cardiac arrest, but it can still occur. In adults, cardiac arrest is often cardiac related, but in children and infants, it is often due to respiratory problems. Next, we'll see an example of cardiac arrest that underscores the fact that sudden cardiac arrest can happen anywhere, at any time, to anyone. Hi guys, have a good weekend, Sarah. I'll see you on Monday, Joey. Harold, your mom called. She said she's going to be a few minutes late. Harold? Harold? Harold, hey. Hey, buddy, can you hear me? Nurse Helen, I need you to come to room 109. I've got an emergency. A child collapsed. Someone help! I have an emergency! Help! Someone help! I've got an emergency in here! Oh, Helen, I have a child, Harold. He collapsed. He's just lying there. Did he fall above his head? No, not that I saw. Harold? Harold, can you hear me? Harold. Go to my office and get the AED. It's on the wall in the hallway, just outside the office.
911, what's your emergency?
One of our teachers witnessed a student collapse. I'm giving CPR right now.
What's your address?
Edison Elementary, 724 North Block Drive, room 109.
All right, I've dispatched EMS. While they're on their way, I'll need to ask you a few more questions.
Okay, I have you on speakerphone.
What's the victim's age?
5 or 6?
Is there an aid nearby?
Yes, I sent someone to get it.
Are you able to give compressions and breaths?
I'm giving compressions now, and I'll give breaths as soon as I get the pocket mask from the AED. And the AED is here now. Okay, can you hand me the pocket mask? Yes. And can you attach the AED? Yes.
They're just a few blocks away, so it shouldn't be long.
Good. And that's if they take the Harding Street entrance.
Attach pads to victim's bare chest.
Do you know what the cause of the collapse was?
No, he just slipped over.
All right.
Plug in pads.
One, two, three, 4, 5, 6, 7, 8, 9, 10.
Analyzing rhythm. Do not touch the victim.
Okay, stay clear.
Shock advised. Charging. Stay clear of victim.
Clear. Clear.
Press the shock button now. Shock delivered. Resume chest compressions.
I need you to count out loud so I can help you with your compression rate.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You're doing great. They're pulling into the school parking lot.
Okay, I'll take over, okay?
Okay. Did he fall or injure himself at all? No.
Okay, he's not breathing and there's no pulse. Let's continue CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5.
Dispatch, this is Unit 705. We have confirmed CPR in progress with the child.
12, 13, 14, 15. How long ago did he collapse?
About 4 or 5 minutes ago. I started with CPR, I think it was 5 or 6 cycles, and 1 shock.
5, 6, 7. Thanks for doing all that. Good job. 12, 13, 14, 15.
It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens.
Fortunately for Harold, there were teachers and staff knowledgeable in basic life support and CPR.
There are some differences with BLS for children. One is the chain of survival.
The pediatric chain of survival begins with the prevention of cardiac arrest, followed by early high-quality CPR. Next comes rapid activation of the emergency response system, followed by effective advanced life support, with the final link being integrated post-cardiac arrest care.
So now, let's see that scene again and review some of the aspects introduced.
Once again, we see a moment where it's unlikely that anybody is thinking about cardiac arrest affecting their lives.
Much less in a group this young.
When the boy collapses, the teacher isn't sure what to do. But even though she's not trained in BLS, her actions highlight one of the few important differences between BLS for adults and BLS for children.
This is one of those differences. If a rescuer witnesses a child's collapse, he or she should first leave him, as Harold's teacher does, to activate the emergency response system and get an AED or a defibrillator. However, if the rescuer does not witness the arrest and is alone, if trained, she would be correct to perform 5 cycles of CPR before leaving Harold to activate the emergency response system.
But when Helen, the school nurse, enters the room, she first examines the room for safety. Then she goes right to Harold and checks her responsiveness, breathing, and a pulse. She has the teacher retrieve the AED from outside her office, and she immediately calls to activate the emergency response system. And because no pulse is present, she starts compression. In fact, with children and infants who have no pulse or a pulse of less than 60 with signs of poor perfusion despite adequate oxygenation, CPR should be started immediately.
As the nurse continues CPR, she also gives the dispatcher information over the phone that will be relayed to EMS already on their way. And when the teacher returns with the AED and kit, she has the teacher provide the pocket mask from the kit so that she can give breaths, because earlier breaths are a higher priority in the rescue of children than in the rescue of adults.
And it's important to note that delivery of breaths to children requires less volume and force. However, you still need to provide enough air to see the chest rise.
As the teacher is getting the AED attached, the nurse continues with compressions and breaths in the 30-to-2 ratio.
So here we see the shock delivered to Harold. It makes perfect sense for the school AED to have pediatric pads, though not all AEDs do. If there are no pediatric pads available, it's acceptable to use adult pads on a child or infant. Once the shock is advised and delivered, compressions are resumed. If 2 trained rescuers are available, the 1 rescuer ratio of 30 compressions to 2 breaths would switch to 15 compressions to 2 breaths.
Now the EMS team comes in and assesses the situation. The nurse continues with compressions and breaths until the EMS team is ready. Then they'll continue CPR on site until ROSC is achieved, and they'll transport Harold to the hospital.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First of all, under the American Heart Association BLS guidelines, anyone from age 1 to puberty is considered a child.
Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls.
When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's about 2 inches or 5 centimeters, and the chest must recoil completely between compressions.
Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, as we mentioned in the recap of the previous scenario, if you are a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
Okay, I'm going to stop there and interrupt because that was what I was mentioning earlier in class. That is the only exception. Otherwise, it's a 30-to-2 ratio. If you have a 2 rescuer for a child, then you would go to 15 compressions and 2 breaths. So I just wanted to stop and point that out real quickly.
Another difference has to do with when to activate the emergency response system. If you do not witness the arrest and are alone, you should perform 5 cycles of CPR to ensure that the victim's brain is oxygenated before you leave the child to activate the emergency response system.
That's also important. You want to remember that. So you would do 2 minutes of CPR on a child or infant before you would leave their side to call 911 if you're a single rescuer.
However, as we saw in the previous scenario, if the arrest is sudden and you witnessed it, leave the child, activate the emergency response system, get the AED, and then return to the child to perform CPR.
So now let's take the BLS for adults that you've learned and apply it with changes to practice BLS for children.
For this session, we will practice 2 rescuer child CPR using a 15-to-2 compression to ventilation ratio. 1 person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here to give everyone time to get into position.
All right. Okay, so does that make sense? The 2 minutes you want to try because that gets that oxygen into their brain. So do what you can if you did not witness it. So if you did not witness them going down, you want to go ahead and do at least 2 minutes before you leave that child's side, if you have to leave their side. Most of us have cell phones nowadays, and they're usually somewhere on us, on our person, in our bag, on our desk, whatever. So if you can grab your cell phone, just do that. But that is the rule, so to speak, for pediatrics. You want to go 2 minutes before you leave their side. All right, so again, verify the scene is safe. If it's a child, if you were, for a child or an infant, you want to tap on the bottoms of their feet if they're not wearing shoes, or they didn't do that with the kid. You know, he's a little bigger, so they shook his shoulders, but we'll get into that again with the infant. You kind of tap their feet. But again, you check for responsiveness. If they are not breathing, obviously no pulse, then you're going to just start CPR right away. For checking the pulse for a child, you would use the carotid, or you could also use the femoral artery. okay, on a child. So you do the carotid or the femoral. And then for an infant, you would check the brachial pulse, like about right here. So that's the easiest place to find it on an infant because usually they are full of rolls, just squishy little rolls that you just want to love all over. And you can't really get your fingers in there all the time. So just lift up their arm and check their brachial pulse. That's the best place to check for a kid, for a baby, for a baby. All right, I covered that. The baby pulse brachial, the child is carotid or femoral. Again, up to 5 seconds, no more than 10. You're checking for the pulse and the breathing. If the kid is not breathing and the pulse is present, you just want to monitor. If the victim is breathing normally and a pulse is present, you monitor them. If the victim is not breathing and not breathing normally, but a pulse is present, then you would just give those rescue breaths, one every 5 to 6 seconds. Okay, so remember that if there's a pulse, but they're not breathing, you still need to give those rescue breaths. All right. And again, same thing with an adult. If you hear a gasp or like a snorting sound, that's not breathing. All right, so again, it's the same compression rate, 100 to 120 per minute. If you're single, solo, you're 30 compressions, 2 breaths. If you are a double rescuer, then you're 15 and 2. All right. All right, let's see here. I think that takes us straight over into the babies. So let me do one quick demonstration because they mentioned the one hand. So again, if you're just doing a one hand on a child, can you guys see okay? If they're small enough, you can just use the one hand, but it's going to be the same way. But again, for a child, you're going to go how deep? For a child? You may remember?
How old?
For a child, so for 8 and under, from 1 to 8, or 1 to puberty. How deep? What depth?
Just under 2 inches.
Almost 2 inches.
Almost. You got it. That's that key word, almost 2 inches. All right, because for an adult, it's what?
2 inches.
At least 2 inches. Yep. Okay. All right, so one-handed for a child, unless they're a bigger sized child, then you could go to the 2-hand. All right, baby, straight into the baby. It's my little baby. Her name is Emma. My stepdaughter named them all when I got them. So this one is Emma. Let me put her bag mask on. We will do a mouth-to-mouth demonstration on the adult here towards the end. But for the baby, for time savings, I'm going to do the breathing for the baby at the same time. All right, so now with the baby, I will say this. If the baby is on the ground when you find the baby, I would highly suggest you pick the baby up and put her on him or her on a table or a countertop or something that's going to lift the baby off of the ground, because you do not want to try and do CPR breaths on an infant laying on the floor. Okay? You're going to break your back. All right, so for the baby, I always say, make an I love you sign. We're going to use these 2 fingers. And the reason I do these 2 is because they're closer in length. These 2 fingers for me are closer in length than these 2. Some people will do it like this, but for me, my middle finger is bent. I'm not getting, or my first finger is like an extra little digit there just hanging out. So for me, I use these 2 fingers. So I tell the baby I love them. So again, okay, so for a baby, if you're solo, it's going to be 30 compressions and it's going to be 1.5 inches deep, okay? So it's going to be the same. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. For an infant with a tiny head, you're going to put your mouth over top of the nose and the mouth of the infant. You're still going to do the chin lift. Hold on, I got to blow my airbag open. Okay, you don't want to blow that hard into the baby. I had to open my lung bag up. So you would just little chin tilt again. Put your mouth over top of the mouth and the nose. And again, 2 breaths. Now you don't need to do deep breaths because that baby's lungs are small. So you don't need as much as you would need for an adult. Then you'd go back to your 30 compressions. And I'm not counting out loud, but this is the compression. So you count out loud. We'll say 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Two breaths. So again, so you can do a full 5 cycle of 2 minutes on an infant before you leave their side to go call 911 if you don't have the phone close. All right, let's see. So, I think we have a baby video too. All right, let me go ahead and play the scenario for the infant. Let me make you guys small again. And we'll go straight into the infant.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the huge difference in saving a loved one.
And we never know who a victim might be, regardless of her perceived health or age.
I'd love to see Dr. Edwards today. I've been checking on her every few minutes. She has a fever and an increased rate of breathing. Okay. Oh, half an hour would be great. Okay, thanks. Bye. Chloe, can you hear me? Chloe, can you hear me? Hi, I have an emergency. I'm at 1819 Redview Lane in Plainfield. Okay, I'm gonna put you on speaker.
What's the emergency?
My daughter, she's not breathing and no pulse.
Okay, I'm sending fire and EMS. Do you know CPR?
Yes, I just started CPR. I'm a nurse practitioner.
Do you know what happened?
My daughter, she's been sick for the last couple of days, and I was just getting ready to take her to the doctor.
And she's how old?
10 months old.
Okay, they're on their way. Can they enter the house?
Yes, the front door is open. Come on.
Good. I'll stay on the phone with you until they arrive.
Okay.
She should be counting out loud.
I need you to count out loud so I can help you with your rate of compression.
Okay. 1, 2, 3, 4, 5, 17, 18, 19, 20, 21, 22, 23, 24. I'm in here. Help, please, I'm in the living room. 7, 28, 29, 30.
I'll take over compression. Get ready to give breath. No pulse or breathing. Continue CPR.
Dispatch from truck 81.
Dispatch, go ahead.
1,
Update
2,
EMS.
3,
We have
4,
confirmed
5,
cardiac
6,
arrest on an infant.
7,
CPR in progress.
9, 10, 11, 12, 13, 14, 15.
Okay, real quickly now, I want to bring this up. When you have a 2 rescuer for infant, do you see how she is doing this encircling with her hands and she's pressing with her thumbs? I'll show you that as well when the video's done.
You see her collapse?
No, I was on the phone and I looked away for a second and it must have just happened.
5, 6, 7, 8, 9,
Attach pads.
10,
Victim
11,
bare
12,
chest.
13, 14, 15.
Plug in pads.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Analyzing
1, 2,
rhythm.
3,
Do
4,
not touch
5,
the victim.
6.
Clear to analyze.
No shock advised. Resume chest compression.
Start CPR.
1, 2, 3, 4, 5, 6.
It can feel like a completely different activity to perform rescue on an infant, but essentially, The principles of performing CPR on infants less than a year old are the same as for adults. There are just a few differences, but the differences are significant.
So let's take things in the same order as we did for adult CPR. Right now, we'll talk about the skills for 1 and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse, followed by infant compressions, and then we'll go on to breaths with the bag mask device. Finally, we'll combine those for practicing 2 rescuer infant CPR.
First, if a rescuer witnesses a child's collapse, he or she should immediately activate the emergency response system and get an AED or a defibrillator. However, if the infant collapse was not witnessed and there is no response or breathing, check the brachial pulse immediately. Then, if you don't detect a pulse, perform 2 minutes of compressions and ventilations before activating emergency response.
To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, when attempting to feel the pulse, press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds, and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 beats per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest, just below the nipple line. But be careful not to press on the bottom of the breastbone. With that correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Deliver compressions at the rate of 100 to 120 per minute. After each compression, allow the chest to recoil completely. As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or about 1.5 inches or 4 centimeters. Allow the chest to completely recoil with each compression. And count out loud as you deliver 30 compressions.
So let's get into position to practice compressions.
Okay. All right, so I am going to take and go straight into the AED for the infant. We will watch those. Let's see here. There it is. Here it is. All right.
There are some differences for the use of an AED for infants and children under 8. Some AEDs can deliver either an adult or child shock dose. The child dose is used in children under 8. If you're using a pediatric capable AED, it will have features allowing a child appropriate shock. But which feature is available depends on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children under 8 years of age. If it does, use them. If not, use the adult pads while making sure that they don't touch or overlap. However, you should not use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and will likely not be successful. It's better to provide high-quality CPR than attempt to shock an adult victim with child pads. Some AED pads recommend a different pad placement for infants and children, placing 1 pad on the chest and 1 pad on the back. Follow the pictures on the pad packages for proper pad placement. In infants under 1 year of age, if defibrillation is needed, a manual defibrillator is preferred. However, as we've mentioned before, this device is quite different from the AED, and it requires special training not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
Attenuator, that's what I was trying to think of earlier and said we would get into it a little later. So that kind of, you would be able to hook that attenuator up to an adult AED and it would deliver the right amount of shock for an infant. Okay, so let's see here for infant. We've already covered bag mask. I'm not gonna make you guys watch that video for infant. It's the same exact bag mask technique that you would use on an adult. So I wanna get into ventilation techniques real quickly, and then we'll do some choking, and then we'll be just about done. So All right, so the different ventilation techniques. We have advanced airways like they use in our ORs, the LMAs, ET tubes, things like that. So that obviously is going to be an advanced airway is going to be done by either an EMS person or the in-hospital cardiac arrest. Obviously, we are not going to carry around those items. So we definitely won't be placing any advanced airways, but it is important to know the different types. So you guys are familiar with the ET tubes and the LMAs. One thing that this covers just a little bit of, they don't teach a lot about the mouth-to-mouth resuscitation these days because people don't want to put their mouth on other people's mouths, understandable. But it does have a brief description here about the mouth-to-mouth resuscitation. And again, for an adult, I'm just going to grab my adult real quick. So for an adult, breathing, let's see, let me make my screen bigger so I can see myself as well as you guys. Okay. So again, for an adult, don't fall off a little, Emma. You would pinch the nose because you don't want the air coming back out of the nose after you breathe, you know, once you blow into the mouth. I don't know if you've ever done that to your kids or anything, but you can blow into their mouth. And yeah, I did that to my daughter. She would laugh. But anyway, you pinch the nose because you don't want that air coming back. This hand will be on this forehead while that nose is pinched. So you're assisting yourself with that, or you do the chin lift, but you give two nice breaths. And again, you're looking out of the corner of your eye as you're giving these breaths to make sure that chest is rising. And so we're getting a good chest rise. That way you know the air is going in. So for an adult, again, you just pinch the nose, do the chin lift, blow directly into the mouth, or you use your mask protector. Aubrey, can you do me a favor? I'm gonna have her bring my I have a sample one. In that Tupperware in there, there's a box in the Tupperware part. There's a box of those mask barriers. Will you bring me one of those, sweetie? Okay, so, and again, after she gets that in here and I get to show it to you guys are gonna each get one of these from me. It's a keychain. Keep it with you. All right, again, so breathing techniques for infants, mouth to mouth to nose, mouth to mouth and nose, I should say. So you're going to cover both their nose and their mouth. You're going to have to turn the light on, sweetie. It's a black box inside the Tupperware. Okay, I'm going to, while she's looking for that, I'm going to play this real quick instruction video on mouth to mouth. Thanks, honey. 2 minutes.
As we mentioned, the majority of cardiac arrests happen at home. Just as you saw the mother give mouth-to-mouth breaths, you may need to give breaths to a family member or close friend when you're not at work.
So this section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to the victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, the air you breathe into a victim contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen to the victim.
Let's go through the steps to deliver mouth-to-mouth breaths to a victim. Start by holding the victim's airway open with a head tilt chin lift. Pinch the nose closed with your thumb and index finger, using the hand that's on the victim's forehead.
Then take a regular breath and seal your lips around the victim's mouth, creating an airtight seal. Give one breath and blow for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. And if you're unable to ventilate the victim after 2 attempts, promptly return to chest compressions.
And to reduce the risk of gastric inflation or air entering the stomach, avoid giving breaths too rapidly or with too much force and volume. Make sure you give each breath over 1 second and deliver air just until you make the victim's chest rise. In an infant, the mouth-to-mouth and nose technique is preferred. To do this, open the victim's airway with the head tilt chin lift. Place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you can't cover the infant's nose and mouth with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
Most of what we've covered today has to do with procedures performed if the victim doesn't have a pulse. But another thing to know is what to do if the victim has a pulse but isn't breathing effectively. At this point, rescuers should give breaths without chest compressions. This is known as rescue breathing.
For adults, give one breath every 5 to 6 seconds, or about 10 to 12 breaths per minute. And for rescue breathing given to infants and children, deliver one breath every 3 to 5 seconds, or about 12 to 20 breaths per minute.
And give each breath over 1 second. Also, make sure each breath results in the visible chest rise. And during rescue breathing, you should check the victim's pulse about every 2 minutes. We'll pause here to give everyone time to get into position.
Okay, so mouth to mouth, I basically kind of covered that. I guess you really didn't have to watch that video. Let me see if there's any more you have to watch. There's certain ones that I absolutely have to play for you guys, and then there's ones that I don't necessarily have to. Like this one, breathing with an advanced airway. This one talks a little bit about an opioid-associated life-threatening emergency. And in your book, when you get your book, there is a section on opioid-associated life-threatening emergencies. One thing I wanted to talk about, I'm not going to play that video because I think it'll take too long. Let me make you guys big. Quick. Okay, so if you come up to a person that is unresponsive, whether they may just be completely out of it. They may have a heartbeat, they may have a breath, they may be breathing, but they are just not waking up. If you suspect drug overdose, naloxone, okay? You ever heard of that? You squirt this into their nose, and if they have basically are going through an OD, this will bring them out of it. So I have 2 of these. They just stay in my first aid kit. If you know anybody, if you have any family members that have to take things regularly for pain, and I'm not judging because my mom is one of them, she takes a Vicodin every day. She can't function with her knees if she doesn't. So anytime anybody has a regular prescription of something like that, the pharmacy will usually give you one of those just in case there's an emergency in your home. That's why I have my 2. So first aid kit, I wanted to real quickly talk about it. It's a good idea to have one. I'm a little OCD, maybe because I teach. I literally have a tackle box, and this is all my first aid stuff that I have here. And I literally have a fishing tackle box. I showed it to you guys a little earlier. Okay, this is the inside of it. This is my mask barrier that I keep for this in case. I may have already showed this to you guys before. I don't know if I did. This is a battery operated bovie. Handheld battery operated bovie. So if we were out camping and somebody cuts themselves open and there's a bleeder, I could take this, touch it, squeeze the button, cauterize it right there in the campground. So they use these a lot for eyeballs. They're eyeballs, very famous for eyeballs. So I have that. I have a little bit of everything. I have gloves. I have spray. I have eye wash. I have a little bit of everything. But again, I'm a little OCD about it. But I've taught CPR and first aid for a few years. So when I teach CPR and first aid, believe it or not, it's a much more detailed class. I don't get it. You would think that as medical people, we would be required for that. But no, we just do basic life support. We're not arguing. It's easier, right? This is the pocket mask that I told you about. So it comes like this. As a keychain, see a little pocket? It's a one-time use, obvious reasons. You open it up, It looks a little something like this. Can you see the diagram on it? The nose and the mouth, the face, the ears. So it shows you exactly where to place it. I'm not sure about the ones that I give you guys. I've never opened one of these. These are my training barriers that I give out if you guys were on site. But it basically looks something like this. You'd put it over top of the victim, and then you would blow over top of this portion into their mouth, but it creates a barrier and it protects you. Okay. The other little mask that I demonstrated with earlier today, the one-way valve on this thing prevents you ending up with, say if the patient starts vomiting, maybe you've pulled them out of a pool and you're doing CPR, this one-way valve will prevent that from coming up into your mouth. So if you're gonna collect stuff and have a first aid kit, probably not a bad idea to invest in one of these pocket masks. You know, like I said, I've had mine for a few years. I've, knock on some wood, I've never had to pull it out for any reason or use it, but it's there if I needed it. So, but these came with my training kits, so I have 3 of them. I keep one that I've never opened. It's still sealed up in the plastic. I keep that one in my first aid kit. But yep, as I see you guys, I will give you one of these. I have another order coming because I only have like 12 left, so I've got another box being delivered to my home. So I will give you guys those as we see them. All right, so opioid, we talked about that. If it's in the overdose, if you've got the naloxone, great. If not, and they're not breathing and there is no pulse, then you just start CPR just like you would, right? All right, we talked about the mouth-to-mouth choking real quickly. We're no longer allowed to call it the Heimlich maneuver. I don't know if you guys have heard this, but Dr. Heimlich passed away in the last few years, and his family will not allow us to call it the Heimlich maneuver anymore without them receiving some sort of royalties from it. So,
wow,
right? It's ridiculous. All right, so we're not doing the Heimlich maneuver anymore. We're doing the abdominal thrust. So you guys aren't with me, so you get to watch a demonstration. But I will show you first for an adult. Okay, so you got the belly button right here, and then you got the xiphoid here. So between the belly button and the xiphoid, you want to be in the soft spot where the diaphragm is, right? You're going to take your fist like this, your dominant hand, make a fist sideways. Then you're going to put your other hand over top, and you're going to push in and up, in and up. Now again, first thing you're going to do when you come up to somebody that's choking, the first thing, well, this is the first sign, they're holding their throat, but you have to ask someone, is it okay if I help you? Okay, you can't just go start putting your hands on them. They could sue you, okay? So you have to ask, hey, are you okay? Can I help you? They're probably going to shake their head yes. So, real quick demonstration. Again, if you guys were with me, you'd get to use it. But you're not. This is my training gear. I will tell you while I'm trying this on that the only time that you will change your hand positioning is if the person is too big, if you can't get your hands around them to their belly area. Or on a pregnant woman, you would come up here to the chest, just like where you do the compressions, and you would do your as hard as you could on the chest. So for somebody that you can't get your arms around, or a pregnant woman, you would just right on the chest bone, and that's where you would do it as hard as you could. For demonstration, Aubrey is going to pretend that I am choking. This is my demonstrator. Okay. So I'm going to pretend I'm choking, and Aubrey's going to show you guys what to do. Can I help you? Did you see that? Did you guys see that pop out of there? So it landed over there somewhere. This is one of my favorite trainers, but again, it's not the same unless you're in person using it. But this is a great way to practice. She saved my life. She got my steak out. But anyway, I just had to show you guys this because this is like one of the most fun things because this is the belly button here. Anyway, okay. So now one thing you want to do, one thing that's important is if you are doing that, if you are trying to do the abdominal thrust on someone, you want to put your dominant leg between their legs in case they start to fall. Because if that steak or whatever it is stuck in there long enough, they're going to collapse. Okay? Last thing, choking on a baby. All right, so for a child and adult, you would do the abdominal thrust. For an infant, 1 or less, you are going to do, you're going to support the head all times, right? Okay, so you'll support the head. And if this baby's choking, you're going to use this arm. You're going to do 5 chest blows, basically, just like CPR. 1, 2, 3, 4, 5. Head bang down, because gravity helps. Then you would flip the child to this arm. See how the body is between, my arm is between the legs. I'm supporting the neck and the face here. You can see that, so I'm supporting. Then you would give 5 back blows. 1, 2, 3, 4, 5. Then you're going to flip them back over, and you're going to continue that same step. 1, 2, 3, 4, 5. Until either something comes out or that baby becomes unresponsive, and then you have to start CPR. Okay? Does that make sense? 5 chest, 5 back blows. Keep repeating. You don't ever want to do a blind sweep. I'm sure you guys have heard this, that you don't ever want to stick your fingers in there and do a blind sweep. If you see something in the back of that baby's throat and you think you can grab it out safely, then absolutely. But you don't ever want to do like a blind sweep with your finger, because whatever is lodged, you could push it further down in there. All right. All right, guys. So let me play our conclusion. And then I'll see if you guys have any questions.
So we've covered a lot today. You learned the proper BLS rescue techniques of CPR and the use of an AED for all ages, as well as how to perform in a 1 or 2 rescuer scenario. You've also learned rescue breathing and what to do for someone who is choking.
Thank you very much for your time and attention today, and especially for your commitment to learning these critical life-saving techniques. We appreciate and honor the important work you all do as healthcare professionals.
One of the cases I remember, the medics called and they were bringing in a guy who was having an acute MI. And so we were ready for him. My task was simple. I did compressions at, an appropriate rate, and I could focus on that.
It was one of the best calls I've been in. Everything moved very fast. Everybody knew what they were supposed to do. Everybody knew their role.
That's how the system is supposed to work.
As long as you're part of the team and everyone works together, you're gonna do okay.
I oftentimes show up on the worst day of people's lives, and I get the opportunity to try to make it better.
Doesn't mean you're always going to get a positive outcome. It doesn't mean that the patient is always going to recover, but it's our job to make sure that the patient gets every possible chance for that.
All right. All right, hold on, guys. Stop sharing. There we are. Okay, so we have 2 options. We have 30 minutes left in our class. We can either do the Kahoot now, and you guys can screenshot it, get it uploaded, and you're done for the day. Or I can give you the Kahoot, and you can take it and play it by yourself, but you would have to have it uploaded by 5:30. Do you guys just want to go ahead and do it now? That way it's done? Okay. All right, let me, oops. I want to minimize it. Hold on a minute.
Our internet's down, so I have to be on my phone. I don't know if it'll work.
Oh, okay, okay.
So if not, can you just post the link, so just in case I can take it later?
Yes, I can do that as well.
Yeah, I sent you a screenshot of our internet being down.
I think
the kids are losing their minds.
Yeah, I just saw that a second ago. That stinks. All right, hold on here. Sorry, guys. Let me get my Kahoot pulled up. Gotta love the slow computer. Okay. You guys, anybody have any questions or comments about that while we're pulling this up? Anything that anybody didn't realize or that you found shocking or anything like that? All right, here we go. That actually took a little bit longer than I thought. I figured it would take about 4 hours to do that in full. All right, here we go. Log in, come on. All right, basic life support, here we go. All right, let me. Okay. All right, it's loading our game. All right, let me share my screen with you guys again. Let me stop recording as well.